I'm going to bring in now our panel to discuss this. That is Tom Borelli. He's a Newsmax insider and America's Voice News contributor. Also, Peter Pitts, president and co-founder of the Center for Medicine in the Public Interest. Good to see you both. Peter, I'll start with you. Is this a good idea to up the manufacturing of the swab testing, or should there be more of a focus on antibody testing or vaccines?
Well, you really can't have one without the other. One of the issues of manufacturing is we need more and more high-quality products, whether they're complicated machines or assays or swabs. And the best bet is to manufacture them here at home, which is another part of the story as well. So it isn't a question of prioritizing. We need all of these objects, and we need a lot of them, and we need them fast.
Tom, who's going to be making these swabs? Do we know, and how quick would we possibly see these?
Actually, Shaun, we don't know. I don't think the company has been made. Names have been made yet. We don't know. But I think the most important part, I think what Peter was going to refer to, is the fact it's really our supply chain that is really crucial. And that's why President Trump was right all along with his America First agenda. We rely on China way too much for not only for masks and other protective equipment, but also antibiotics. I think they make over 90% of our antibiotics. We cannot allow China, who first place lied and hid about the virus, to hold us hostage over antibiotics and other precious medical equipment. So I think the silver lining of this very dark cloud is going to be the fact that we really need to bring our precious manufacturing for these really crucial antibiotics and medical devices and test kits here at home, not abroad.
Tom, I'd like to ask you too, as far as therapeutics for this, we are a long way away from a vaccine, but to get there and to help others, are there any promising therapeutics we're seeing right now?
Well, last time I was on your show, I mentioned Gilead Sciences had a drug called remdesivir, and it had some very early preliminary results out of Chicago. And this is a brand new antiviral drug. It did not work against other viruses, the Ebola virus, but it seems to be working again in this preliminary test with patients in Chicago, and they're doing a number of clinical trials. So this is what we need. We need those antivirals to combat this virus. Testing is one thing, important, but we need therapeutics to really stop it in its tracks.
Yeah, Peter, I want to also talk to you about this, social distancing. A lot of experts encouraging the public to practice social distancing, staying 6 feet apart. But there are researchers that say herd immunity is the only way to stop a respiratory disease like COVID-19. What are your thoughts on that?
Well, herd immunity comes when the herd is vaccinated, and we're not there quite yet. So what stands in its place is personal responsibility, social distancing, a degree of isolation, which clearly is going to be loosened up sooner rather than later. But once we open up the economy, masks may remain, social distancing will certainly remain, hygiene is going to play an important role, technology, certainly relative to working from home. But that's not a medical therapeutic, that's personal responsibility. So new therapeutics, existing therapeutics that are repurposed for COVID, and personal responsibility is going to be the answer until a vaccine comes on the scene.
To get this country up and running again, to get businesses back open, people out spending money again, paying taxes on items again, is it about getting that vaccine out there? Is it about the testing, Tom?
Well, the vaccine, when it comes, is going to be at least 12 months to 18 months away. So we got to get the economy going before then. That's why I really support President Trump's new policies, giving the states the ability to free up their economies in local areas. It's not one size fits all. The governors have to know what's going on in cities and counties, take that data, and then use that to free up the economy. And another aspect could be, it could be another policy where we let the younger people go out and work, since the results with the virus have been much better, and really protect the older people, those with pre-existing conditions. That would be another policy that could be adopted going forward.
Peter, your experience with the FDA, can you weigh in on that?
Yes, I think there are a lot of therapeutics out there that are being tested against COVID-19. You mentioned remdesivir from Gilead. That's got interesting potential, but right now it's anecdotal. And that's an RNA-based antiviral, as is the Sabin oral anti-polio vaccine, which also has early data showing it may be productive against COVID. So there are a lot of tools out there. We've got to collect the real-world data, let doctors make their own decisions, while also simultaneously collecting the serious clinical data to make our solid decisions going forward.
All right. Great advice, great tips. Peter Pitts, president and co-founder of the Center for Medicine and the Public Interest, former with the FDA. Tom Borelli, Newsmax insider and America's Voice news contributor. Guys, thank you so much.